Clindamycin Hcl is a medication used to treat bacterial infections. It works by stopping the growth of bacteria. It is important to note that this medication only treats bacterial infections and will not work for viral infections such as the common cold or the flu. It is crucial to use this antibiotic only when necessary, as using it when it is not needed can cause it to be ineffective for future infections. The dosage and timing of Clindamycin Hcl should be determined by a healthcare professional based on the specific infection being treated. When taking Clindamycin Hcl, it's important to follow your doctor's instructions. Typically, you'll take this medication 4 times a day, about every 6 hours. You can take it with or without food, but make sure to drink a full glass of water with it, unless your doctor tells you otherwise. After taking the medication, avoid lying down for at least 10 minutes. The dosage will depend on your medical condition and how you respond to the treatment. For children, the dose will also be based on their weight. To get the best results, make sure to take this antibiotic at the same times every day. This will help you remember to take it and ensure that it's working effectively. It's important to continue taking this medication until you finish the full prescribed amount, even if your symptoms improve. Stopping the medication too early could cause the infection to come back. If your condition doesn't improve or gets worse, be sure to let your doctor know. If you experience nausea, vomiting, or diarrhea while taking Clindamycin Hcl, it's important to let your doctor or pharmacist know. It's also important to remember that this medication has been prescribed to you because the benefit to you is greater than the risk of side effects for most people. However, it's important to be aware of any serious side effects and contact your doctor right away if you experience heartburn, joint pain or swelling, yellowing of the eyes or skin, dark urine, or signs of kidney problems. Using this medication for prolonged or repeated periods may lead to oral thrush or a new vaginal yeast infection, so it's important to contact your doctor if you notice any white patches in your mouth, a change in vaginal discharge, or other new symptoms. While a very serious allergic reaction to this drug is rare, it's important to seek medical help immediately if you notice symptoms such as fever, new or worsening lymph node swelling, rash, itching or swelling of the face, tongue, or throat, severe dizziness, or trouble breathing. It's important to note that this is not a complete list of possible side effects, so always contact your doctor or pharmacist if you notice any other effects not listed. If you're in the US, you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. If you're in Canada, you can report side effects to Health Canada at 1-866-234-2345. If you experience diarrhea that doesn't stop, abdominal or stomach pain/cramping, or blood/mucus in your stool while taking Clindamycin Hcl, it's important to let your doctor know right away. This medication can rarely cause a severe intestinal condition due to a bacteria called C. difficile, which may occur during treatment or weeks to months after treatment has stopped. If you have these symptoms, do not use anti-diarrhea or opioid products because they may make symptoms worse. It is important to follow your doctor's advice and not to self-medicate. Before taking clindamycin, it's important to let your doctor know if you have any allergies to clindamycin, lincomycin, or any other allergies. This medication may contain inactive ingredients that can cause allergic reactions or other issues, so it's important to discuss this with your pharmacist. It's also important to inform your doctor or pharmacist about your medical history, especially if you have liver disease, kidney disease, stomach or intestinal diseases such as colitis or C. difficile-associated diarrhea, and any allergic conditions like asthma, hay fever, or eczema. Clindamycin may affect the effectiveness of live bacterial vaccines, so it's important to inform your healthcare professional if you are using clindamycin before getting any immunizations or vaccinations. Before undergoing any surgery, make sure to inform your doctor or dentist about all the medications you are taking, including prescription drugs, over-the-counter drugs, and herbal products. If you are an older adult, you may be more sensitive to the effects of this medication, especially diarrhea. If you are pregnant, it's important to discuss with your doctor before using this medication. Additionally, clindamycin can pass into breast milk, so it's important to consult your doctor before breastfeeding while using this medication. When taking Clindamycin Hcl, it's important to be aware of potential interactions with other medications. This can affect how well the medication works and may increase the risk of serious side effects. It's important to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. Never start, stop, or change the dosage of any medicines without your doctor's approval. One product that may interact with Clindamycin Hcl is kalinpectin. Be sure to discuss any concerns with your healthcare provider. Remember to follow their guidance for the best results. If someone has taken too much Clindamycin Hcl and has severe symptoms like fainting or difficulty breathing, it is important to seek immediate medical attention. In the United States, you can call your local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center for assistance. It's important not to share your Clindamycin Hcl medication with others. This medication has been prescribed specifically for your current condition, so do not use it for another infection unless your doctor instructs you to do so. If you are using Clindamycin Hcl for an extended period of time, it's important to have regular lab and medical tests, such as kidney and liver function tests, and blood counts. Be sure to consult your doctor for more details on this. If you forget to take a dose of Clindamycin Hcl, take it as soon as you remember. If it's almost time for your next dose, just skip the missed dose and take your next dose at the regular time. Don't take a double dose to make up for the missed one. Make sure to store Clindamycin Hcl at room temperature, away from light and moisture. It's important to keep it out of the bathroom and away from children and pets. When it comes to getting rid of any leftover medication, don't just flush it down the toilet or pour it down the drain unless specifically told to do so. Instead, be sure to properly discard the product when it's expired or no longer needed. If you're unsure about the best way to dispose of it, consult your pharmacist or local waste disposal company for guidance. And always remember to keep all medications out of reach of children and pets for their safety. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.